We all know that pandemic has taken a toll on our lives for the past 2 years, and face masks have ideally become a part of our outfits. It's even more appropriate to say that masks have kind of become a fashion statement nowadays. Hey guys, welcome back to my channel. Today we're going to be talking about a condition that hasn't been spoken a lot, that there is a condition called as mask mouth. So without any further delay, let's get into the video. So due to this continuous wear of masks for long hours, it has ultimately resulted in increased number of patients having dry mouth, bad breath, tooth decays and gum diseases. When you're wearing your mask, you breathe through your mouth. When we breathe through our mouth or our chest or our neck, it is just shallow breathing rather than complete long breaths that happens from the diaphragm. So when there is shallow breathing, what happens? It ultimately leads to dry mouth. Dry mouth means there is decreased secretion of saliva, and when there is decreased secretion of saliva, there will be more number of bacteria in your mouth, because saliva's action is to flush out all the bacteria and reduce the incidence of tooth decays. The second one is dehydration. Obviously, when you're wearing your mask, you'll not be really interested in removing all of that and then drink water and then wear it back. All of us are lazy. Even without wearing a mask, drinking water is a task, because I'm also lazy. Anyways, when you're wearing your mask, we tend to ultimately decrease the water intake, and that leads to dehydration. Again, that leads to bad breath. So the third one is the air that we recycle, that we breathe in and breathe out. Normally when we breathe in, we take in oxygen. When we breathe out, we leave out carbon dioxide. Now when we're wearing a mask, the carbon dioxide tends to get trapped inside, and when it's trapped for a longer period of time, it changes the acidity of the bacteria that is present in our mouth. So when the acidity of the bacteria that's present in our mouth changes, it ultimately leads to inflammatory conditions like gum diseases. With gum disease, I mean you might have bleeding gums, which is called as gingivitis. There are two obvious things that one can do. The first one is deliberately trying to breathe through your nose and not your mouth. And there are certain exercises that have been recommended, sequence of what you can do to train your respiratory muscles to breathe a certain way when you're wearing a mask. I'll give a link down below in the description. You can go to that link and check the exercises out if you're interested. I completely understand if you do not want to complicate with all these exercises and stuff. You can just concentrate on breathing in and breathing out completely through the diaphragm rather than just short bursts of respiration. The other obvious one is, again, increasing water intake and consciously taking an effort to have 2 to 3 liters of water every day, even if you're wearing a mask or not. So this will come as a broken record. Brush your teeth twice a day, floss between your teeth, use interdental brushes, and do clean your tongue also. So these are the oral care measures that you can take at home. You can ask your dentist to prescribe you a mouthwash that does not contain alcohol, because alcohol normally tends to cause dryness of the mouth. When it comes to your diet, you can avoid having coffee and alcohol, because again, as I said, alcohol and also coffee, both of them cause dryness of the mouth. Next one that I would like to say is, please change your mask once in a while, because even your mask tends to collect bacteria inside, and if it's not clean, again, this will also contribute to any kind of infections inside the oral cavity. If you find that you have any of these symptoms that I've just mentioned, and if you feel like the preventive measures that I suggested is not helping you, I would suggest you have a call with your dentist before you visit them, and see that it's safe to get treated first. That's it for today's video. I think you understood what I tried to say, what I tried to convey. If not, again, leave it in the comments down below. If you like this video, do not forget to like, share and subscribe to this channel, and do not forget to follow me on my social media account on Instagram mainly, because that's where I'm more active than YouTube for now, and I'll see you in my next one.